Well, 1 year ago, I joined RRS, and I found a really good release of information company that I thought could be a great release of information company. 25 years ago, RRS was formed in the suburbs of Philadelphia by a guy originally from Pittsburgh who was a big hockey fan. Most of our original clients were in the Philadelphia area or the Pittsburgh area. Back then, medical records were all paper charts, and the idea or concept of release of information was still in its infancy. So back then, the founder would get in his car in Philadelphia with a copier in his back seat inside of a hockey bag, and right before he got to Pittsburgh, he'd take his Philadelphia Flyers hat off, put on his Pittsburgh Penguins hat, and walk into the offices of his clients. He used to tell me that he had figured out just how to get the copier right so that he could copy paper continuously without having to stop, and he would copy thousands and thousands of pages. Around the same time, I was starting my first summer job. I grew up in a small town in New England. My mother was a nurse practitioner, and my first summer job was helping at the local family practice. And I would sit there and call patients before their appointments, and I would pull their charts before their visit, and then I would sit with them in the waiting room while they were waiting to see the doctor, and I would listen to their stories. And that's what medical records are. They're a story. They're a story about a people with a history and on a journey. If you looked at my medical records, you would see that I had terrible knee pain through 2 half Ironmans and 1 full Ironman about 4 years ago. And after the type of pain that like your friends get tired of hearing about, really bad. And I went to numerous orthopedic consults and chiropractors, and everybody told me I had IT band syndrome. The problem is IT band syndrome goes away after 6 months, and mine just kept going. Mine never went away. So I finally demanded an MRI. And in that MRI, we found a small cyst underneath the pathway of my IT band. 1 short 5-minute visit later, and I had no more pain. That was my story. I joined RRS to let other patient stories be heard. Each week, we handle thousands of medical record requests. And in the aggregate, they're just statistics. But when you remember that each record is a person, and each person has a story, and they're on a journey, your perspective begins to change. Unfortunately, ours is not the only perspective. For many who don't understand the complexity of releasing medical records, it seems like it should be really simple. Intake a request, deliver the record, do it fast, get it right, and do it for as low cost as possible. The problem is, it's not that easy. Many people outside of healthcare and some within healthcare don't understand the complexity of releasing a medical record due to the patchwork of IT systems around the country that do not speak to each other, the myriad of state and federal regulations that we're bound to adhere to, and there's many outside threats that we have to worry about when we're releasing a medical record. Speaking of external pressure, the HITECH Act 10 years ago had a great idea: digitize the healthcare industry. 10 years later, the government still can't understand why there is no interoperability. Well, one of the things that happens when you create an entirely digital healthcare network framework is that you suddenly have all the data vulnerable to external attacks. Breaches, malware, and of course one of the easiest things that people are doing now is targeting employees through phishing scams, which can be very effective. So we have to worry about all of that, in addition to the reality of delivering a record, which is a lot more steps than people fully appreciate. AAOE, which RRS is a member of, which is the Association for Healthcare Information Outsourcing, put together this slide, which is a 45-step how-to on how to deliver a medical record, which is broken into 5 unique parts. The process is no different whether you take that process in-house and do it yourself, or if you decide to outsource it to someone like RRS. If you decide to work with someone like RRS, no longer is it a 45-step process, but it's a 2-step process for you. Intake requests and upload them into our portal, or task them to us through your EMR system, and we simply do the rest. Steps 3 through 45. We authorize the request. We retrieve the information from your EMR system. We protect the information. We have dedicated compliance experts and audit experts. And we handle releasing the information and invoicing on the back end. So that's what I inherited, a really good company that did release of information. But what we've done over the last year is really try to make RRS a world-class provider. And we've invested heavily into technology, compliance, educational resources, and all of it with the goal of helping to empower our clients' patients on their healthcare journey. We do that with 3 pillars: innovation, security, and kindness. Innovation. Innovation's an overused word, but it's important to understand what we've actually done in terms of accomplishing innovation. This weekend, we are demoing for the first time our new patient technology, which will be a front-end system for patients to interact with directly so that they can request their medical records. You know, I just relocated to Philadelphia as part of this job with RRS, and I had to find a new doctor. And so I went through the process on the phone, and they said, "Great, what's your address? We'll mail you a new patient package." Okay. And they said, "We'll include in there a form which you can mail to your doctor to get your records released." This is 2019. I hate going to the post office and buying stamps. With our technology, nobody will have to do that anymore. We've expanded our services. Before, we were just a release of information company. Now we provide additional services such as electronic chart indexing, disability forms and FMLA forms completion, and we also provide payer audit response services. Lastly, we've innovated the way we are providing reporting to our clients. It's so interesting to me when I talk to clients and I say, "Well, how many requests do you get each week?" And they say, "I don't know." And I say, "Well, doesn't your provider tell you that?" No, they don't. We don't think it's good enough to simply, just do the job. We want to show you what we're doing. More importantly, we want to show you where your data is going. When we actually provide our clients a record of where the data is moving to, who are the top requesters of your information, you start to see some patterns, and it can actually be eye-opening. And I think all of us should know where our data is going in this world. Security. In the last year, we've embarked on a comprehensive security overhaul. I've brought in a CTO, 2 additional developers, a CIO, and anybody else who would want to come talk to me about technology. Everything from hardware to software, and our network infrastructure is being completely vetted. We're conducting pen testing, and that's just table stakes. I think that's what everybody needs to be doing now. But just getting the technology perimeter correct is not good enough, because once you make it in, all your employees are they're easily targeted, and they can be very vulnerable. So we've also implemented very stringent training and testing of our staff. We've created RRS University, which was a crazy idea we had about a year ago and has now become a reality. But it's our educational knowledge center for our clients and our employees. And we've done so far our first webinar about a month ago, and we will continue to add to those. We have blogs there, and we'll continue to build out that library over time. All of our staff have now been, are now required to take the CRIS test, which stands for the Certified Release of Information Specialist test, and that will continue to be a requirement of employment at RRS. So security is not just getting the perimeter correct, but it is providing tools and training and resources to your staff, and I'm very proud of what we're doing in that regard. And lastly, kindness. Kindness because it matters to me. Kindness because it's the right thing to do. By the time a patient calls us about their medical record, things aren't going well for them. And you have to remember that these people have their own journey they're on, and we have to support them. In the last year, we created a dedicated customer service team, and we now provide live answers for over 90% of our phone calls, and a same-day response for any that we don't answer. We have a dedicated client success team. In the past, we used to have salespeople going out to find new clients, and we had our operations team working with all the existing clients, but there was no relationship manager for the client. So when they actually had a problem, they weren't sure who to call. So we've now created a dedicated client success team that looks after just that problem. And then there's cultural change. Cultural change is hard. Anybody who's ever led an organization knows that moving culture is very difficult. I read recently, if you can be anything in life, be kind. And so we stress that every day at RRS, and we hope that the changes that we're making there come through in the way we treat each other, the way we treat our clients, and ultimately the way we treat our clients' patients. I understand that we're just one small part of the healthcare universe and just one small part of a patient's healthcare plan. But if we can help support their journey and get their story to be heard, we'll have done our job well. That's the new RRS. We're at booth 514. Please come and see us. Thank you very much.